crisis. Hospitals are literally turning people away. There are very limited resources and they're being stretched.
Well, this fourth surge of COVID is growing at a record pace, with today seeing the largest increase in hospitalizations in over a year. Good evening and thanks for joining us. I'm Sharice Gibson.
And I'm Katie Moore. While the number of COVID-19 patients in hospitals is now making daily headlines, there's another problem many hospitals could soon face.
One local doctor told a U.S. Senate committee member today that burnout among doctors and nurses could have dire effects as the pandemic's fourth wave hits Louisiana. It's all being driven by the Delta variant, as well as the lack of vaccinations. Danny Monteverde has more on the battle healthcare workers continue to wage and the toll it's taking on them.
One of University Medical Center's top doctors warns another crisis could slowly grow inside his hospital and others as the Delta variant continues to spiral out of control.
We've strained the human beings providing this care to a critical point.
Dr. David Jans, UMC's Director of Medical Critical Care Services, told the bipartisan Senate Committee on Health, Education, Labor, and Pensions that this fourth wave of COVID-19 surging in Louisiana has many healthcare providers near or at their breaking points.
The past and current COVID-19 surges and future healthcare crises will likely be characterized by running out of healthcare workers rather than running out of ventilators.
The American Nurses Association estimates that 500,000 nurses alone will retire by 2022, with more jobs available in that industry than any other in the country. Jans's testimony came the same day the State Department of Health announced 6,700 new COVID cases, the largest single-day increase since March 2020. With that, 1,300 people in the hospital, an increase of more than 150 since Monday. That's the largest single-day increase for hospitalization since last March. According to Jans, the reasons for a possible staffing crisis in the medical field are obvious.
Over 1/3 of healthcare workers are experiencing anxiety or depression. As many as 1 in 4 are experiencing symptoms of post-traumatic stress disorder, and symptoms of burnout are experienced by over half of critical care physicians. This is the state of the workforce asked to return to the COVID-19 front lines for a second, third, and now fourth wave.
Just as obvious, according to Republican Senator Richard Burr of North Carolina, is a way to avoid that from happening.
If there's a headline today or tomorrow on what this hearing's about, I would suggest it's this. If you're not vaccinated, get vaccinated.
Danny Monteverde, Eyewitness
we
News.
Work out